Medical wastes are generally handled with more care than regular domestic wastes, most especially those used in treating patients with infectious diseases. COVID-19 ranks high, if not tops, on the list of infectious diseases at the moment. Isolation and treatment centers for COVID-19 are now spread across the country. Increased testing for the virus means more laboratories springing up by the day. All of these result in the use of medical materials and kits exposed to the virus and in need of safe disposal.
In the hospitals, you don't just dump your waste anyhow. You have places where you take your waste to, because they are hazardous waste. It can harm the environment, it can harm human beings. So the best bet is just for the waste to be disposed properly.
National Environmental Standards and Regulations Enforcement Agency, NESRA, has provided guidelines for safe handling of infectious waste generated in health centers.
From the normal general waste generated from the hospital, about 85% of the waste is a normal domestic waste. Only 15% is infectious. But if you look at COVID-19, due to the nature of the disease, almost all the waste that is generated from the isolation centers are considered as infectious.
The guideline has provision for cleaning of beddings, non-consumables used for patient care, personal protective equipment, and transportation of wastes from hospitals to incineration points.
Incinerators doesn't have to be on site, and incineration is not the only system of treatment of this infectious waste. Mind you, for the fact that they are infectious, it has a time limit for the infection. After some time, it will no longer be infectious. There is also steam sterilization. You put it in steam, or you use autoclave to autoclave before you dispose. When you make it inert, it's no longer infectious. You can now dump it.
There is also provision for sanctions against defaulting health service providers. In Abuja, Onengiye Fine Face, NTA News.